Welcome to Sonu's Art on YouTube Academy official. Today's topic
is refractive surgery for myopia. About SMILE laser eye surgery. Small incision lenticule extraction, SMILE, is an outpatient laser eye surgery procedure that changes the shape of the cornea to correct refractive errors. It is FDA approved only for the treatment of myopia at this time. Currently, we do not offer this procedure at the Institute, but will in the future. In SMILE, topical anesthesia is applied to the surface of the eye. Next, a femtosecond laser cuts a small lens-shaped disc or lenticule of tissue within the cornea. The shape of this lenticule is calibrated to match the refractive error of the eye precisely. The surgeon then extracts the lenticule through a separate cut-down incision, also made by the laser, to produce a shape change in the cornea. Your surgeon can explain the limits of myopia that can be treated by SMILE. Treatments for astigmatism and hyperopia are not yet approved. Not every patient is a candidate for SMILE eye surgery. Patients with thin corneas, progressive ectasia, scars, irregular astigmatism, and a few other pathologies are ineligible. Your surgeon, or one of the optometrists in his or her practice, can determine if you are a suitable candidate during a free screening examination. What to expect with SMILE eye surgery. SMILE laser eye surgery typically takes about 20 minutes to perform per eye, and both eyes are usually treated during the same session. SMILE is associated with minimal to mild discomfort while it is being performed. When the topical anesthesia wears off, however, the level of discomfort increases. Most patients develop redness and tearing. There is often stinging and a gritty sensation that lasts 6 to 12 hours. Visual recovery is slower than with a laser-assisted in situ keratomileusis, LASIK procedure, typically taking 2 to 7 days. As with any procedure, there is a risk of complications with SMILE, including the possibility of an undercorrection or overcorrection. The risks should be discussed with your doctor before you undergo the procedure. Enhancements are usually performed by photorefractive keratectomy. SMILE, small incision lenticule extraction, is a laser eye surgery that treats astigmatism and nearsightedness. SMILE may mean that you don't need to wear glasses or contact lenses anymore. You do have to meet certain criteria to be eligible for the surgery. Contents overview procedure. Details risks, benefits recovery and outlook. When to call the doctor, additional details. When to call the doctor. Overview. What is SMILE eye surgery? In small incision lenticule extraction, SMILE. Eye surgery, your surgeon uses a laser to reshape your cornea and treat astigmatism and nearsightedness. SMILE is a minimally invasive surgery. Its name gives an idea of what happens. The laser creates a lenticule and a tiny incision, less than 4 millimeters long, into your eye to remove your lenticule. Lenticules are disc-shaped pieces carved into your cornea by the laser. The shape of the tissue is like an MMR. Removing the piece of tissue is what changes the shape of your cornea. What does SMILE eye surgery treat? Your eye care professional may suggest SMILE surgery if you have refractive errors and want to be able to see without using eyeglasses or contact lenses. They may recommend SMILE eye surgery over other types of corrective surgeries if you have a higher prescription or issues with dry eyes. People who are candidates for SMILE eye surgery are at least 22 years old, haven't had a significant change in their prescription in a year, have prescription ranges that fall between specific parameters, nearsightedness that falls between 1 and 10, and astigmatism up to 3 diopters, have healthy corneas, are able to understand the benefits, risks, and limitations of SMILE eye surgery. Who shouldn't have SMILE eye surgery? Your eye care provider may not recommend SMILE eye surgery if you are pregnant or breastfeeding, chest feeding, have frequent changes in prescription for glasses or contacts, have severe glaucoma, have scars on your cornea, have certain types of skin disorders, have keratoconus, have unmanaged diabetes, have a cataract that's affecting your vision, have had certain kinds of eye surgeries, injuries, procedure details. How should I prepare for SMILE eye surgery? In a pre-surgery appointment, your surgeon will examine your eyes to confirm you don't have any other eye diseases or conditions that mean you shouldn't have SMILE surgery. They'll map out plans to remove the lenticule from your eye. For example, they'll measure your cornea's curvature and thickness. Your provider will let you know how to prepare for surgery. They'll ask you about the medications and over-the-counter supplements you take. They'll let you know about medications you should stop taking before the surgery. They'll also tell you when you should stop taking them before the surgery. Your provider will advise you if you need to stop drinking or eating the day before the procedure. What happens during this procedure? Your surgeon will numb your eye. They'll use a femtosecond laser for the surgery. The laser will create a small disc of tissue from your eye that looks much like a soft contact lens. It will be thicker in the middle and thinner along the edges. This disc is the lenticule. Your surgeon will use the laser to make a small cut into your eye so they can remove the lenticule. By doing this, the surgeon changes the shape of your cornea. Thanks for watching. Don't forget to subscribe.